to the media briefing of the Department of Higher Education, Science and Innovation that will be announcing the measures that the Department of Higher Education and Training will be implementing in the post-school education and training sector in response to COVID-19. You'll recall that the last briefing that we've held was on the 30th of April, and we promised that from time to time we'll brief South Africans on the development within the sector in line with the NCC pronouncements on various levels and measures that the government in total is taking. Today, the Minister of Higher Education, Science and Innovation will give us a statement detailing the measures that will be implemented going forward. With the Minister, we've got the Deputy Minister Manamela, and we also have the Director General, Ubabu Kwebs-Konde, who are currently joining the Minister, and we're also having officials of the department that are senior officials of the department that are joining the Minister today and will be helping us to navigate through this media briefing. My name is Ishmael Mnisi, and I'll be helping to facilitate this media briefing for today. Thank you very much. Without any further ado, I would like to call upon Minister Nzimande to come and give us the statement. Then immediately thereafter, we'll have a presentation from Higher Health on measures that we'll be implementing when the institutions are reopening. And from there, we'll go to our section on the question and answer, where we'll give members of the media an opportunity to ask questions through the media platforms that we have sent. We are not going to take direct questions from myself, but please use the links that we have sent to you to ask questions from those, and we'll respond to those questions only. If you don't have the links, please check the GCIS website. You'll find our media alert, which contains the links where members of the media can ask questions. I would like to call upon Minister Nzimande to come and read the statement for us. Thank you.
Thank you, Ishmael. I'm removing the mask not because it mustn't be worn, but as my commitment to my sister who has a hearing challenge, and all those South Africans who have got hearing challenges, they need to also read my lips so that they can follow what we are saying. Let me greet our Deputy Minister, Manamela, Director General, Kwebs-Konde, and all our DDGs who have joined us here. Let me also welcome the Administrator of NSFAS, Dr. Randall Carlson, all members of the media, ladies and gentlemen, and everybody at home or wherever you are following on this update. COVID-19 has disrupted the 2020 academic year. But as we committed in our 30th of April media briefing, we've been working hard during this month of May towards saving the academic year while saving lives. The pandemic has presented all of us with a set of unprecedented challenges, and we've been intensely engaging with all our stakeholders to save the 2020 academic year while simultaneously continuing to focus on the transformation and expansion of opportunities in the post-school education and training system. I would like to express my gratitude to the exemplary leadership provided by our President, Cyril Ramaphosa, and my colleagues in the National Command Council and Cabinet in guiding our work at this difficult time. I also remain humbled by the commitment of all the members of the ministerial task team led by our Deputy Minister Manamela, comprising of the South African College Principals Organization, Universities South Africa representing the Vice Chancellors, the various trade unions who are organizing in our sector, as well as the South African Students' Union and representatives from the TVET College students. The task team has been playing an important role in finding creative and equitable solutions in the interest of all our students and staff in our sector. I also would like to acknowledge the role played by the leadership of the various trade unions organizing in our sector, especially our labor unions represented by NEHAW, SATU, the Democratic Teachers Union, NTEU, the Public Service Association, SAPTU, and NAPTOSA, as we collectively seek solutions to deal with this pandemic. In our recent engagement with the unions, they raised a number of important issues and suggestions, including how they think health and safety measures need to be strengthened in all of our institutions. Arising out of this engagement, we've decided to help convene a consultative meeting specifically between USAF, SACPO, and union representatives organizing in the sector shortly. We are also calling on all our post-school education and training institutions to ensure full consultation with student and staff stakeholder bodies into university and college COVID-19 task teams to provide all necessary safeguards on managing risks and ensuring safe resumption of activities. We furthermore call on all councils to ensure that this is indeed put into place, including a matter that the unions rightly raised, the establishment of workplace occupational health and safety committees. I would like to reiterate that our sector's response to COVID-19 is guided by the measures announced by the President as decided upon by Cabinet and the National Command Council. Our sector has adopted the theme, Save the Academic Year, Save Lives. Let me start by referring to what NSFAS is doing at the moment. During the period of the lockdown, NSFAS remained fully operational and continued to disperse allowances to all NSFAS beneficiaries. We wish to underline this. All NSFAS beneficiaries are receiving their allowances as if they were in institutions. I'm also pleased to indicate that NSFAS has concluded an agreement with the South African Revenue Service to provide NSFAS access to latest tax data in order to validate household income of NSFAS applicants. NSFAS will now also be able to include other income, such as investment and rental income, in its applications assessment. This will greatly assist towards finalization of outstanding appeals through reliable sources of information. Our initial analysis shows that more than 125,000 new students in 2020 come from households in the informal sector. Our partnership with the Department of Social Development saw a dramatic improvement in approvals for social welfare beneficiaries, and more than 240,000 new entrants were approved for funding by NSFAS. Taken together, indeed, NSFAS is truly providing for the most vulnerable and the poor members of our society by opening up gateways out of poverty. The shift to provide for learning materials for NSFAS students to include digital devices will not only address technology-enabled pedagogy over the lockdown period, but will truly move South African education into the modern era offering access to wider resources and teaching materials. This bold step will also be extended to TVET students for whom access to technology will improve their skills fit for a modern economy. Ngamanye amazwi, ama-laptop lawa, ama-computer, sizowanika bonke abafundi njengoba besishilo, abaxhaswa isikhwama lesi sika-NSFAS. Akuzukuba abafundi basemanyuvesi kuphela. Okokuqala ngqana abafundi basemakolishi bazothola lama-computer ukuze kwazi ukuthi umsebenzi wabo wenzeke kangcono. Recently, the NSFAS administrator assisted 70 medical students at the Walter Sisulu University to obtain funding from the Health and Welfare SETA, students who entered medical studies following a NSFAS-funded science degree. During this lockdown period, we have also been providing stipends to all our SETA learnerships. We have also cleared the misunderstanding that existed at the beginning of the lockdown, where some SETAs stopped the payments, and this has been corrected. On universities, all our public universities, 26 of them, have developed detailed strategies for remote, multimodal teaching and learning during the period of the current lockdown for implementation as from the beginning of June as per our previous commitments. So work is continuing and there is significant progress in this regard. As I have indicated before, institutions have developed now their detailed institutional plans as each institution is unique and we cannot follow a one-size-fits-all approach. And we have encouraged our institutions to continue communicating with their students. Each institution is committed to ensuring that all students are given a fair opportunity to complete the academic year 2020. We are working closely with all universities to ensure the implementation of this commitment. University teaching, learning assessment, and campus readiness plans have been submitted to the department along with a detailed costing of the additional funding required to implement them. In other words, last time we said we were going to do this, now we've done this. We have got all the plans by the institutions. We are just finalizing costing so that we are ready for teaching plans to be implemented as from the 1st of June. Nibuyeni ngiphe namanzi. Abaphethe amanzi. What we are doing as the Department of Higher Education and Training, we are now reviewing these plans in order to urgently finalize the reprioritization of earmarked funding to support the implementation of teaching and learning plans by 1st June. Higher Health, which is our organization that was initiated by our institutions to look after the health needs of staff and students, is assisting with the review of the campus readiness component of the plans, which will assist to ensure that adequate COVID-19 health and safety standards are put into place across our system. And they will, after I finish speaking here, provide a short presentation and an update for the benefit of everyone as to what they are doing now to make our institutions ready to receive students. The funding that will be reprioritized will be approved as a special COVID-19 responsiveness grant. Now, on devices for NSFAS and Funza Lushaka University students, we acknowledge that the cost of connectivity remains a huge barrier for students who want to use the digital learning mode as part of our multimodal and remote learning. I want to thank the officials in my Department of Higher Education and Training, my colleagues and officials in the Department of Communications and Digital Technologies, as well as the electronic network providers, including the mobile network operators, that have already zero-rated educational content sites of our public universities, TVET, community education and training colleges, including agricultural and nursing colleges. What does this mean? It means that access to websites from all of our institutions is essentially free. That is what zero rating means. That it's not, we are not going to use your data to be able to access these zero-rated sites. You're not going to be charged. This is a very important, it's a huge step. Sorry. It is a huge step forward in terms of effective collaboration between the department and the telecommunications sector. The next step is to make education data bundles available to all NSFAS students in universities and TVET colleges that they can use to pay for additional contents that is not covered through zero rating. So in addition to zero rating, I'm pleased to announce that we have successfully negotiated with all mobile network operators very favorable rates for our NSFAS students, including the Funza Lushaka students who will receive 10 gigabytes daytime and 20 gigabytes nighttime for 3 months, starting from the 1st of June till end of August, as subsidized by government, which means it's free for them. In weeks to come, we will give detailed information on how to access these offers. While we acknowledge that students who fall within the so-called missing middle category, as well as students in private institutions, also need support in accessing data for their online learning, as many of them also come from homes that are hardest hit by the impact of COVID-19 pandemic. Unfortunately, government is currently not in a position to subsidize them. We, however, appeal to the mobile operators to work with institutions to also offer affordable packages to such students. I am, however, working towards establishment on an affordable higher education loan scheme, which will have to involve the private sector to help missing middle students. I want to repeat what I said in my previous statement, that NSFAS and the Funza Lushaka students must ensure that they register their cell phone numbers with their respective institutions. We advise that during this period, they must also not change their SIM cards so as to enable network operators through their institutions to load data to their devices. I just want to emphasize that this data that needy students will receive must be used for dedicated online educational platforms for teaching and learning as approved by institutions. And I want to emphasize that. I said it last time. Don't use this data for wrong things. And I've gotten many responses on my Facebook indicating that many, if not most, of our students know exactly what I mean when I say don't use this data for wrong things. It's for you, it's to help you, to enable you to participate and engage in your studies. I therefore would like to acknowledge and thank all the network operators, MTN, Telkom, Vodacom, and Cell C, who have been working with us to ensure that we deliver on this important intervention. We have also made free digital content available specifically to our TVET college students through our Department of Higher Education and Training website, the National Open Learning System of our department, institutional website, and other sites where students can find digital materials which will assist them in their learning and preparation for exams. I therefore call upon all our TVET students to visit these sites and see for themselves the myriad of content available to assist them. Universities will also be delivering paper-based teaching and learning materials to students who do not have the resources to engage electronically or online. Some have already started doing this, but in terms of our target, this will increase as from the beginning of June. The physical delivery of learning materials is one aspect of our multimodal approach that many of our universities are implementing. Ngiyabonga sezafika manje. Cheers kulo ndawo ye data. Now, the implementation of this intervention of physical delivery of materials depends on each university's assessment of the number of students that require this kind of support. As we try to find better ways to implement effective multimodal augmented remote learning systems, we are considering the use of space science and Earth observation technologies through our Department of Science and Innovation and platforms in support of our plans to reach to vulnerable students. My Department of Science and Innovation, in conjunction with the Department of Communications and Digital Technologies, CENTEC, and the South African National Space Agency, is currently looking at a long-term solution to supporting the digital transmission needs for the national education system through the launch of a locally produced communications satellite. The Center for Scientific and Industrial Research, the CSIR, also falling within the Department of Science and Innovation, is also completing the task of establishing a geospatial planning map, identifying the location and distribution of learning and co-learning sites in all the districts of South Africa to enable us to support students in the period before full return to campuses. As stated in our last briefing, government is committed to ensure that all NSFAS students have access to an appropriate device to support their online learning and to ensure that no student is left behind. I want to say that some universities have already issued their students with laptops, including NSFAS beneficiaries, some as part of their normal policies, others as a response to COVID-19. So this has started already. A lot of work then had to be undertaken to quantify the exact number and location of the students who still need to be issued with devices. That work has now been completed, and procurement will commence as soon as the approval of the Minister of Finance is received, which we are expecting anytime from now. Now, on the risk-adjusted strategy for the post-school education and training sector, the PSET sector is committed to resume academic activities in line with the National Risk-Adjusted Strategy. This includes putting remote learning system in place, as well as planning the gradual return to various campuses during various phases of the risk-adjusted strategy. Our ministry will publish national directives on the broad parameters and conditions under which each institution must plan for the controlled resumption of all forms and levels of academic activity to complete the 2020 academic year. Now, let's start with level 4 of the risk-adjusted strategy, which the whole country is in as we speak right now. Under level 4, we allowed for the controlled return of final year students in programs requiring clinical training, starting with medicine, MPCHB, and the phasing in of all other programs such as nursing, dental, veterinary science, and so on. Medical students have been returning to clinical training platforms from the 11th of May, and either final year students in other programs requiring clinical training will begin returning as from the 1st of June 2020. So this is the first level of priority of students to return. All other students are supported through remote, multimodal teaching, learning, and assessment until they can return to campus. That's what we are doing now under level 4, which we are in. Now, level 3. Under level 3, which has not yet been announced, but when this level gets announced, we are going to allow a maximum of 33% of the student population to return to campuses, delivery sites, and residences on condition that they can be safely accommodated and supported in line with the health and safety protocols as directed by the Department of Health and indeed our department as well, where appropriate. This will include the following cohorts or group of students who will form part of this 33%. It will be all groups that have already returned during level 4, as I have outlined. But then also we will then prioritize students in the final year of their programs who are on a path to graduating if they finish their 2020 academic year completely. Also, amongst this group, the first 33% will be final year students who require access to laboratories, technical equipment, data, connectivity, and access to residence and private accommodation will also be allowed to return to be part of this first 33% at level 3. Students in all years of study will also be allowed to return if they require clinical training in their programs, provided that the clinical training platforms have sufficient space and can accommodate them while adhering to the safety protocols, especially physical distance and maintenance of personal hygiene. The other group of students that we will allow under level 3 to go back as part of this 33% will be postgraduate students who require laboratory equipment and other technical equipment to undertake their studies. In addition to the above, institutions may also consider selected return of other categories of students to residencies who may face extreme difficulties in their home learning environments, provided that the above categories are prioritized and all safety and logistical requirements are met. When a district moves to level 3 of the strategy, then the reintegration of the next group of students to return to campuses located in that district will take place. So, for example, if in a particular district, level 3 is announced to begin on the 1st of June 2020, then institutions where campuses are located in that district will recall students in line with the following criteria to start their contact tuition 2 to 3 weeks after the announcement, depending on readiness and capacity of each institution. In other words, if by 1st of June there is an announcement that we are moving either in the whole country or parts of the country to level 3, we will then start 2 to 3 weeks after that announcement to have the first 33% of the students to return, not all the students. Cela kuyichaza lento. Uma ngabe kuukuthi isimo siya ngokuba ngconywana uhulumeni abesethi siyasuka kuleli zinga okuthiwa ulevel 4 siye zingene elingconywana ulevel 3 sesingakwazi ukuthi kube khona abafundi basemanyuvesi esithi sebengaqala ukuthi babuyele emanyuvesi kodwa abazukuba ngaphezulu kwabafundi koyedwa wabathathu 33%. Ngifuna ukuthi nabazali emakhaya bayizwe kahle lento akuyena uhomlo wokuthi hayi ke kosho ukuthi ke sekuphindela wonke umuntu emuva ngoba esikoleni ngoba uma sike sakwenza lokho siyobe sidala ingozi enkulu ukuthi kulahleke impilo zabafundi nabasebenzi nabafundisi balezi indawo zethu. Ngisho lento ngoba ngiyazi kunabafundi asebethi nje hayi namhlanje uNzimande sifuna nje akhuluma into eyodwa sibuyelani sonke home asizusebenza kanjalo ngoba impilo zabantu lezi esibhekene nazo so uhulumeni sinomsebenzi omkhulu ukuthi sivikele impilo zabantu kufanele abantu abafundi babuyele ngalendlela ukuthi sizokwazi ukwenza zonke izinto zokuthi bavikelekile baphephile. Ingakho sithi nakubaholi babafundi msana ukugcina ngokuthi nizothi kuthina abafundi bafuna ukubuya uma umholi hamba uyobatshela labo bafundi bonke abafuna ukubuya ukuthi anikwazi ukubuya nonke ukuba umholi kusho lokho awuthathi yonke into oyishiwo umuntu ngoba naku umlandeli wakho kufanele abanye ubabonise ikakhulukazi wena uma umholi unolwazi ngoba sikwazi ukuhlala nawe phansi la kule sasigungu esiholwa usekela lethu uminister uBhuti Manamela la kuxoxwa khona ngalezi zinto ngithi angigcizelele lento ngoba lento yokuthi kuvele kujaha ukubuya nje abantu bazicabangele bona ayizukusiza ayivumelekile futhi emthethweni. We know all of us that a lockdown is not nice, but a lockdown is not made to punish people, it's to save lives. We therefore urge everybody to abide by this. Now, if then level 3, for argument's sake, were to be announced to begin on the 15th of June, then students would be recalled to start 2 to 3 weeks thereafter. Kusho ukuthi ekupheleni kwa June, end of June or beginning of July. In other words, a period of 2 to 3 weeks will be given in order to allow students to travel and also in order to ensure that our campuses are ready. Higher Health is going to be giving their own briefing after me, which will be clear, will make it clear to everyone what kinds of preparedness are we at and what are the things we need to do in order to ensure that all our institutions are safe places for return by students and staff. I will publish directions in terms of the Disaster Management Act to permit such travel. Institutions will issue permits to identified students to allow for their travel. It is critical that we adhere to these criteria to ensure that campuses are ready for students to safely return and the effective health screening, cleaning protocols are in place to keep everyone safe. All other students who are not part of the initial 33% will be supported through remote multimodal teaching and learning assessment until their turn comes to go to campus. It is recognized that some institutions may identify other groups of students in line with their particular context. However, any deviation from this criteria must be approved by my department and must fall within the maximum of 33% of the student population that will return first once level 3 is announced, hopefully by the president. Now let's move to level 2. When a district moves to level 2 in future of the strategy, then the reintegration of the next group of students to return to contact tuition on campuses located in that district will take place according to the following criteria. Once again, a 2 to 3 week period will be given to allow students to travel back to campuses and for institutions to ensure that the campuses are effectively prepared for the reintegration. Why, by the way, do we say 2 to 3 weeks? We are saying 2 to 3 weeks because it will depend on the capacity of the institutions. Some institutions will be able to do it in 2 weeks, but others may need a week more to be able to adequately prepare because our institutions are not the same. So once each new level 2 in this instance is announced, then we will allow a further 33%, which means now it will be in total 66% of the student population will return to campus for teaching, learning, and assessment in line with the following criteria. It will include all groups that are already returned, students in all years of study who require laboratory and technical equipment to complete the academic year. Under level 3, it will not be all students who require laboratory. It will be final year students, as well as final year students who require the laboratories and other things. Then level 2, it will be everyone who will then be part, who requires a laboratory and technical equipment to complete the academic year. And we really plead for cooperation here. If wenza political science, noma wenza sociology, awudingi laboratory ngani zakwethu. Asizukuprioritize uma sisathatha kancane. Usengakwazi ukuhlala ekhaya, ufunda incwadi yakho ngaleyo ndlela oyifunda ngayo. Ngoba senzelani ukuphepha. Also, as part of level 2, we will then return students in all years of study who require practical placements, experiential learning, workplace-based learning to complete the academic year. And also, level 2 then will see the return of first-year students in all undergraduate programs. In other words, we'll then be prioritizing now to say under level 2, all first-year students, undergraduate, will have to go back. By the way, we will be publicizing this in our website and in other media so that people can see exactly how we are going. Now, we can't say when then, which month will level 2 be. It will depend on when the president announces move to level 2. And in those districts that will move to level 2, then we will follow this guideline that we can then be able to have 66%. And it will happen 2 to 3 weeks after that announcement to allow our institutions to get ready. Because our goal is to save lives. Now, institutions again under level 2 may also consider a selected return, provided it doesn't go beyond the 66% of other categories of students to residencies who may face extreme difficulties of one form or the other. Level 1, we will do as I have outlined for other levels. A 2 to 3 week period after its announcement will be needed to then prepare the campuses so that 2 to 3 weeks thereafter, staff or students, they actually return. And it is expected that then under level 1, only under level 1, will 100% of the students be back to campuses. And we are therefore going to require the strictest enforcement of physical distancing and health protocols. I will be publishing all this, as I have said, in the government gazette, DG, am I right? Correct. So that people know that this is the law. These are regulations also that require to be respected. We urge everyone to cooperate in the same way as our representatives have been cooperating in the task team the ministerial task team led by our Deputy Minister. As reported in our previous statement, we are facilitating the training of almost 18,000 frontline health workers including leadership and membership of trade unions and shop stewards on dealing with COVID-19. I'm also pleased to report that we have already signed a memorandum of agreement between the Health and Welfare SETA and the WITS Health Consortium, and training will resume soon. Now, let me deal with the issue of return to the residences. Within the national guidelines to be published by the department, plans for the return of students to residences will be determined, this is all universities by the way, at institutional level in line with numbers that can be accommodated to enable physical distancing, the handling of communal spaces, hygiene requirements, and dining hall arrangements. Students identified to reintegrate into campuses may include specific groups of students who are living with disabilities, who are not able to access connectivity where they live, or are living in circumstances where studying is difficult. These groups of students for residencies will be part of initially the 33% and later the 66%. But of course, there may be a slight difference between students who are returning for lectures or contact lectures and those who are returning to residencies. But it must all be within the maximum guidelines or numbers that are actually allowed. In other words, in terms of the phase-in plans, the maximum percentage per residence identified for the level 3 is 33%, level 2 is 66%, must be adhered to, and all health and safety protocols must be in place. Students who live in private rented accommodation close to campuses may also return, provided physical distancing arrangements are in place. And we are indeed engaging with private providers of student residences on these matters as well, so that they are also able to adhere to these, because this is national law. This is in line with national regulations that as we seek to save the academic year, our priority is to save lives. So that was on universities. On TVET colleges, for TVET colleges, a tentative academic calendar has been drawn up pending any new announcements on the different levels of the lockdown by the President. In terms of the tentative calendar, the following return dates apply. Again, we will give this, we'll publicize this and publish it. Now, on NATED trimester engineering students at TVET colleges, N6 and N3, they are to return on the 10th of June, N5 and N2 on the 15th of June, N4 and N1 on the 22nd of June. Now, let me say this. Again, all this will be guided by the National Command Council and the epidemiology of the disease. If anything changes for the worse, we will have to change these plans, because the priority is to save lives, even the ones I was announcing about the universities. We are assuming that as we move to lower levels or higher levels, depending on how you describe this, we will be able to do these things. But if in a particular district the situation gets worse and requires different action, we will have to fall in line with our action, including reversal of opening up for students, even in the worst case scenario, asking the students to go back again. We must be absolutely clear about that, and we will be guided by science and be guided by the President and the National Command Council. Now, NATED semester students at TVET colleges doing business studies, and 6 of those will return on the 25th of June, as per our plans now, and 5 on the 29th of June, and 4 on the 6th of July. NCV students, level 4 will return on the 13th of July, Level 3 on the 20th of July, Level 2 on the 27th of July. A campus-based approach will be applied where colleges are affected by different lockdown levels. Campuses located in districts that remain in lockdown level 4 will remain closed, and students will be supported using multimodal remote learning approaches. In other words, we are not opening under level 4 except for those clinical training students. Nobody else. So, if there is move to level 3, we will do as we have said. But for level 4, we are not going to open institutions for those districts that will remain under level 4. So as then announcements are made about possible changes to levels of alertness, you will have to compare that against what we say here. Now, those who will remain at level 4, those colleges will therefore develop a detailed remote learning support plan and share it with students as well as post it on the college website. Several colleges have already developed learning materials both for TV and radio broadcasts, which are shared through our departmental website. These initiatives will continue beyond the return of students to campuses. Furthermore, all students who will not have returned to campuses in June and July will also be supported remotely until they return to campus according to the phase-in process. Colleges are using textbooks, e-guides, past question papers, and uploaded YouTube videos to assist students. These are supported through bulk text messages from colleges and WhatsApp groups set up by lecturers. Let's emphasize this. You can see that what we are trying to do as government is to save the academic year whilst ensuring we save lives. We call upon everyone to also be part of this journey. No one must opportunistically, or in a populist way, try and recklessly want to move outside of these parameters. No one has called for this virus to be with us. No one. Not government, not Nzimande, not anyone. Abahamba isonto ke bona bangayichaza kangcono ukuthi ifike kanjani le virus. But none of us have called this virus. We therefore need to work together and not to act as if we are heroes and heroines who are going to defeat this virus by actually going against these carefully thought out prescripts and arrangements that we are making. This is a period where, by the way, all of us are tested, especially those who are in leadership position. Are we real leaders or we are manga leaders? By actually working towards observing this. On community education and training colleges, it is important to state upfront the community education college system is severely constrained in respect of infrastructure and uses mainly schools' infrastructure after hours. Again, this is what in the past we used to call adult basic education and training centers. It is for that reason that the department has taken a conscious decision that while we are building the infrastructure capacity of the system, for now its academic programs must be aligned to that of the Department of Basic Education, the schools. Therefore, as part of the community education and training college system, preparation for the return of students and staff to colleges and community learning centers, the department continues to engage with a variety of stakeholders, including labor and churches, to strengthen the capacity of the system. Guided by the principle to save lives and the academic year, these community colleges will spend the rest of May 2020 preparing the central offices and the learning centers to be ready for safe return of staff and students, subject to readiness of the colleges and center. By the way, any college or center that is not ready, we're not opening it. That's our commitment. Because we can't risk people's lives. Subject to readiness, the following are the proposed dates for the return of different categories of staff to their workstations in these colleges. 25th of May 2020 would be the return of principals, deputy principals, and supply chain management staff. 1st of June, center managers return. 8th of June, all lecturers return. 17th of June, for students registered for General Education Training Certificate, as well as the Senior Certificate, as well as National Occupational Certificates Qualification or Part Qualifications. Let me reread this. On the 17th of June will be returned for students registered for General Education Training Certificate, Senior Certificate, as well as National Occupational Certificates Qualifications or Part Qualifications. Also, the return of levels 1 to 3 of adult education and training students will be synchronized with the return of learners in the lower grades in the public schools. In the unfortunate event that some learning sites are located in districts and metros that remain on lockdown level 4, such learning sites shall be closed or they will remain closed. We're not going to open where there is level 4. We are still a district, or part of a district is still in level 4. The affected students registered for General Education and Training Certificate, Senior Certificate, National Occupational Certificates shall only get an opportunity to sit for exams in May, June 2021 to enable them to complete the 2020 academic year, all depending on the epidemiology of the virus. On SETAs, Sector Education and Training Authorities, SETAs are currently engaging the employers and skills development institutions, public and private, regarding the return of learners. We are all aware that under the risk-adjusted strategy, alert level 4, there are limited number of employees who can return to the workplaces. However, I would like to make a call to all employers, both in the public and private sectors, even during alert level 4, to turn their workplaces into training spaces. This also goes beyond this level. SETAs have also committed to prioritize skills development related to COVID-19 pandemic areas in support of the supply and demand of essential goods and services during COVID-19 period and beyond, with particular focus on the provision of opportunities for small enterprises and cooperatives. I'm pleased to say that a number of our SETAs, we have drawn them in now to support the training of cooperatives and small and medium enterprises to participate in the production of personal protective equipment, like masks. As a department and as a minister, I still do not understand why we should be getting masks from outside the country under ideal conditions, when these masks, we can be able to produce them in this country. Like I'm having this mask produced by learners, sponsored by the FPNM SETA. It's their product, this, which they've produced here in South Africa, because these would be opportunities for training, opportunities for job creation, even nabantu bakithi abangasebenzi bakwazi ukuthi bathunge ama-mask lawo. Bengikhuluma nenye insizwa yangakithi kaDambuza ukuthi hey, yini umehluko phakathi kwe-mask ne-Cooperhead? I-Cooperhead yona ngabe iyasebenza, cha kuthiwa ayisebenzi i-Cooperhead. Cooperhead ayisebenzi, bayazi ngikhuluma ngani abantu be-Cooperhead kusebenza i-mask. Sicela i-Cooperhead ngani zakwethu siyaxolisa. Now, on the commencement of infrastructure projects, one other important matter to highlight is the commencement of our infrastructure projects in our campuses. All our institutions are preparing for the resumption of construction activities upon gazetting of regulations permitting construction activities in the post-school education and training sector. Such activities will have to be done within the national health and safety protocols as governed by the disaster regulations. I must also highlight that as a department we are working closely and seamlessly with all education quality assurance bodies in South Africa to ensure that COVID-19 measures do not temper or affect the quality of qualifications offered by all our institutions. The measures have only affected the methodology of offering programs by institutions, not the quality of our qualifications. Also, we can't lower standards, as some are wanting to say, because of COVID. We want to help everyone, but we can't lower standards such that our students are carrying certificates that are not respected by anyone. We have to maintain standards. So that is why this thing of pass one, pass all has no place in our education system. We will seek to assist everybody to do well, but we can't have a pass one, pass all. We need to say that up front, and there are no negotiations about that. Now, the last matter that I would like to talk about, because I'm also minister responsible for science and innovation, is South Africa-Madagascar collaboration. Funa ukuthinta le ndaba yomhlonyane kancane ukuze siyicacise emphakathini izwakala. As the Department of Science and Innovation, we have a bilateral agreement with the Madagascar Science and Technology Department, ozakwethu. Specific areas of collaboration include indigenous knowledge systems, particularly traditional medicines research. Our Council for Scientific and Industrial Research has signed a program of action with the Malagasy Institute of Applied Research. Sithi-ke sizobambisana nabaseMadagascar ngolwazi isikhathi esiningi oluye liqhamuke kuyinyanga zakithi nabanye abantu bakithi abazikhambi. Ngoba silifuna yonke indawo ikhambi. Kodwa kufanele senze isiqiniseko ukuthi kulokubambisana kwethu siyakwazi phela ukuthi silibhekisise ukuthi leli khambi liyilo yini, lingasenzeli umhlola esingawazi sithi siyalapha kanti sisidala inkinga ezifweni. Now, following Madagascar's presidential launch of an Artemisia annua product, COVID Organics, the country was advised to seek independent evaluation of the product. As a department, we are willing to partner with Madagascar. We have already been in touch with the Madagascan through our own science councils within the context of the World Health Organization guidelines for evaluation of traditional medicines. Kusho ukuthi siyasizana nabo ukuze kugcineni sazi ukuthi leli khambi lomhlonyana beza nawo ngabe ngempela uyakwazi ukusebenza noma cha. This will include necessary advice on non-disclosure agreements and all related intellectual property rights requirements, which must be cleared up front, sharing of relevant data, conducting all necessary tests on safety, efficacy, and quality. For the South African team to provide this essential service on the African continent, it is critical for both the Department of Science and Innovation and Department of Health leadership to request for the official reference centers for African medicine status from the World Health Organization. In the spirit of Agenda 2063, Africa must leverage its indigenous knowledge, biodiversity, and innovation know-how for building its manufacturing capacity. Before I close, I want to emphasize one very important matter. Not emphasizing this in the end because it's the least important, but I wanted to say it after having said all this. Students with disability are a priority in all these levels and in all these considerations. We must make sure no student with disability is left behind because of his or her disability. That is a firm commitment from our department as part of this government's commitment to help those with disability. Let me end by saying I would like to take this opportunity to once more thank all of our stakeholders who have been participating and also have been part of the consultative processes. There is general agreement and understanding from all our key stakeholders around these things that we're announcing here today. It's not just things that we sucked out of our thumbs. Once more, special gratitude to the President, my cabinet colleagues, senior officials of both my departments, by the way, and all those who have been participating in this. With your permission and patience, Ishmael, I'm not taking over your job. I've got enough of my own troubles. Sizocela kodwa ukuthi laba bezempilo esisebenza nabo beze la bazobeka ngeimfishane. Nishaye ngeimfishane ngani zakwethu ngoba sifuna ukuthi abafuna ukubuza imibuzo nokuthi bacaciseleke bakwazi ukulithola leli thuba sisatshele kwelesikhathi sasemoyeni. Thank you very much.
Okay.
Yeah. Greetings to the Minister, greetings Deputy Minister, greetings to the DG and all the senior officials of the department, colleagues, special friend Dr. Randall from NISFAS, fellow South Africans, and to the people, to the media. Thank you very much, Minister. Minister, I want to reinstate what you from the very first day promised us and always asked us to concentrate was to prioritize hashtag save lives. As much as hashtag save the academic calendar is critical and has been quite elaboratively explained, critically, hashtag save lives needs its absolute attention. And it needs its attention with science. And I think today my presentation will be very much around our preparations in support with all our institutions, whether they are universities, TVET colleges, CETs, skill centers, private institutions, where 2.5 million South Africans, whether they are staff or students, are based. And I think at this difficult times, human lives play a very significant role for all of us. The presentation will be about how we prepare as we move from lockdown 4 to lockdown 3, as we gradually open our institutions of higher learning. Now, how do we put systems? How do we put infrastructure? How do we put proper guidelines in place where we can work towards hashtag save lives, which I think is predominantly very critical at this stage. My first slide, if it's not showing, I will still speak about it. It's about the guidelines for managing COVID-19. Sorry, I'll take time. Sorry.
We can't see the slide. You can see the computer is on.
Okay.
Okay. We can see the teacher.
Ladies and gentlemen, we're just having a technical glitch. We are sorting it out and we'll resume shortly with our briefing.
Thank you very much indeed for joining us. That was the briefing by the Higher Education and Science Technology Minister, Dr. Blade Nzimande. As you saw there, they're having a bit of a glitch. Desiree Chauke has since left. I've taken up the hot seat. Thank you indeed for staying with us right here on SA Today on SABC News Channel. I'm Chabi Sositol, and I'm wearing my African attire just ahead of Africa Day in a couple of days' time. As soon as we get the line back up, of course, at the briefing by the Minister, Blade Nzimande, we'll send you back there. But for now, we're going to take a quick break right here on SABC News Channel. Do stay with us. We have more for you straight after this. Tells me that it seems that that line is back, so we're going to go back to Pretoria. It seems that the minister's press briefing is continuing. Let's go straight there.
On daily screening, protocols on testing, protocols on linkage to care, protocols on PPE, which PPEs for what is for general students, for staff, for PPEs for frontline staff, for student affairs, for campus clinics, cleaning staff, security, etc. We developed protocols on routine cleaning, absolute details around how we should be putting systems for cleaning our classrooms, residences, or offices, and routinely, as well as a protocol on disinfection for any reason. A case of COVID-19 becomes positive, and then a specific protocol starts on that criteria. We cannot achieve this without staff and student volunteers, and a full protocol on who can become a student and staff volunteer, how we can train them, how we can capacitate them, and the comprehensiveness of that every institution of higher learning and every campus where a human life is, will be developing a COVID-19 task team, and Higher Health will support COVID-19 task team when it works towards #Save Lives. The biggest important part is capacity development. There's no doubt that the virus informs people with lots of fear, and the fear is genuine. The fear among students, the fear among staff. So how do we prepare our institutions of higher learning, our management, our different disciplines, student community, before they come into institutions? And from the very first day in April, we started live webinars with the help of NICD and experts towards training and capacitating. So far, close to about 2,000 academics and senior managers in our 26 public universities have been capacitated. And from next week onwards, for the next 3 weeks, we will be capacitating every 26 university when it comes to student affairs, student leadership, when it comes to HR directors, it comes to senior management, student resident officers, wardens, etc. Parallelly, we have just completed all the 9 provincial trainings for all the TVET colleges, with all the regional managers and the senior managers, principals, deputy principals, campus managers, student support. And over about 3,500 academics and student support have already been capacitated. The next phase starts with CET colleges, and I think from the next week onwards, CET colleges will be prioritized towards capacity building across all the 1,800 centers do we have. And parallelly with the skill centers, and of course, now with the private institutions, and I think we are now commencing work with private institutions further in capacity development to them. The most important element is, what do we do when we come towards higher health daily screening, testing, putting a student and staff volunteer program, and very critically, the psychosocial support program. And I'll be speaking about it. There are various actions that we have put in place. Actions on campus screening. As you know, the government regulation is at every public space, you have to do daily screening. So how do we make daily screening possible for thousands of students and thousands of staff members entering our campuses as and gradually on a phased approach we open? And we developed a series of action points. The first action was let's develop technology. Let's use technology. Can through any phone, through a USSD line, through a WhatsApp, through a web-based form, can we do daily screening? And through that, with the help of National Department of Health, we developed an application, which is a digital National Department of Health, Higher Health integrated screening tool, which is available in all the platforms now, and it's called Health Check. Action 2 is mass screening. Can we at the campus entry points develop screening stations and screen those students and staff who will not be able to screen themselves by themselves through their devices or have no access to devices? And can we do for them? And I think that's where we are establishing ourselves and moving towards. If where we have campuses like Rhodes University or UCT, where we or Stellenbosch, where we have institutions that are based in a town, which have multiple entry points, can we go with other action points like class-based screening? Can we develop roving teams of screenings on daily basis for student and staff, and as well as contractors and other service providers coming inside? And as well as we also now putting a rigorous process of residence-based screening, where students will be coming into our accommodations, both private or our own residence program. Residence-based screening is another protocol which is very critical. We have developed an application which, if the slides were there, it's called Higher Health NDOH Integrated Digital COVID-19 Screening Station. This screening needs to be done daily for every student and every staff. The preference is, if you have any device, not even a smartphone, and any simple phone, a tablet, a computer, or a smartphone, any of these devices, you could do daily screening prior to you leaving your home. Daily screening is very critical, primarily because we need to early detect this virus. We need to map and manage COVID-19. If we can isolate people much earlier, in the first early phases of people are showing moderate to high risk of COVID-19, immediately we can reduce the spread of infections, both in our campuses as well as in other public spaces. We are proud to announce that we have a live application. This digital health screening is now live. It's available on URL through healthcheck.higherhealth.ac.za. We'll make this available to everyone, to every student and every staff. We're working with every campus and every institution in going to ensure that this gets into the public space and every student and staff gets access to it. We have a WhatsApp number 0600110000. And that number, if you ever go today and you can check yourself within 1.5 minutes of doing your screening yourself, it will give you your result. And that result will give you in the form of clearance, whether you are on low risk, you are moderate risk or high risk. And similarly, you have a free USSD line, which is *134 *832 *2#. If you do that, you can follow the steps and do your daily screening. It takes about 1.5 to maximum 2 minutes to do your screening every day. The important part is that our daily screening is not only available USSD, it's available through the WhatsApp line as well as through the web form, but it is integrated with the National Department of Health tracking and tracing system. You are immediately risk classified into low, moderate, and high risk. If you are moderate and high risk, it will inform you whether you need to self-isolate, what are the criteria for testing, and also for seeking emergency care. It gives you an everyday on your name, your college, university, your date of when you did your daily screening and expiry, or when this screening will expire. so that you can actually get as a certificate every day, that you can show as being cleared or screened and daily screened, and you can come to the campuses absolutely at low risk. And of course, the National Department of Health has verified and integrated. It is available currently in 5 languages, and we are planning to incorporate all the 11 languages so that the screening can simply be available for every student, every staff and service provider entering inside. Besides having the digital platform, say if 50% of our student and staff community or contractors coming in will not be able to access or will be able to do it, we with every institution are now developing something called like a triage or a screening station at our entrances. And that's what every institution is busy planning and preparing with support of Higher Health. The mass screening will also use health check. There will be no need for a paper-to-paper so that there's no transmission of the virus. And this could be done through devices maintaining physical distance of 2 meters between one student and the other, ensuring that every student, and staff, when he leaves their home, should wear a cloth mask and inside the campuses all the time, and health check will be applied. However, temperature checks will always be there, and as you know, temperature is one of the key symptoms. As much as it comes in time, and there are many more symptoms that could alarm you before, and we could classify you moderate to high risk. That's why the application system and the thermometer system of fever checking will apply together for screening. Student and staff volunteers training has already commenced. As soon as we go into lockdown 3, our peer educators will come, student volunteers will come, staff will come in. With the help of management, we will be establishing the screening teams that will be sitting and adhering to the screening stations and ensuring that daily screening becomes a routine and a possibility so that we can early isolate and prevent the community spread of the infection. In the mass screening, there are various steps. But I won't go in detail, but this presentation will be made available to everyone. And I think if you go through procedural step by step, it explains how the triage building, volunteer training, daily screening, and the system will work at every campus level. The step 5 of this mass screening is a very critical step. It talks about people with no symptoms will receive proper education and health promotion on routine basis, class by class, as well as from a peer-to-peer program on COVID-19 education and knowledge. And at this moment, education of COVID-19 is very critical. We cannot allow myths and rumors to spread around, and proper education. And for this, we have developed various curriculums around. The most important part will be is for those students and staff and other allied staff who will be risk classified moderate to severe. Very immediately, they will be asked to self-isolate, refer to testing program depending on the Department of Health criteria for testing, and of course, referred for seek emergency care because the biggest support at this moment, besides we don't have treatment, is oxygen and ventilation, and that needs a clinical setting around it. All right. And last part of my quick presentation will be also around campus-based screening, which is I've spoken about, roving teams, and I've also spoken similar steps on the residence-based screening. Cleaning protocols have been extensively developed. It's very critical that we are training the cleaning staff, that these cleaning protocols gives a detailed list of what chemicals to use. We're trying to make it simple, every surface to be cleaned, and every classroom residence, how the whole algorithm will work as students come in and in between lectures, how the cleaning process will happen, and what happens if one case of COVID-19 becomes positive, and what kind of another protocol comes when it comes to disinfection of all our classrooms. I would also lastly talk about a campaign on communication. Bulk SMSs are reaching close to about 1 million students regularly and routinely. We have a WhatsApp channel. Our 21 radio campus stations are airing content on COVID-19, educating students through our 200 radio journalists who have been trained. And a study with HSRC that we are now embarking towards finding evidence-based approach towards COVID-19 so that we understand what impact it will impact our institutions of higher learning, our post-school education training system. With that note, I say thank you to everyone, and I'm happy to take questions from there on. Thank you so much. Appreciate it. Thank you.
Re a go leboga Re Ramnik. Re tla tswela pele ka lenanego la rona la media briefing re tsena karolong ya rona ya bobedi. Batswadi ga ile bana se Ramnik na se tlhalosa ke gore a gona gore re ka ya dikolong e le gore garai di institutions tsa rona ga di a netefatsa gore maemo a siame a go sanitizer go lokisa pleke tsa rona gore re netefale gore bolwetse bo ba coronavirus bo keke ba tsena bana mo sekolong ga ba boela mo di-university le di-TVET college tsa rona e sitana gape le tsona di-community colleges so re tlo netefatsa gore maemo a siame gore re ka dumella bana gore ba boele sekolong ngokusho njalo ngizocela ukubiza uTshegofatso noKarabo ukuthi basinikeze ama questions. We are now going to the question session. Tsegofatso and Karabo will now lead us on the questions that the journalists have asked. As I've indicated, we are only going to take questions from these colleagues which have been sent by members of the media only, and then we shall get the responses from the members of the panel. If I may, let me start with Karabo. If there are any telephonic questions that we have, please do lead us on this item. Thank you very much.
Thank you so much, Ishmael. At the moment, we don't have any questions coming from the telephone.
Thank you very much. On that note, it was indeed very clear, Minister. You spoke for more than an hour and explained extensively on the measures that the department will be taking. But can we now go to Tsegofatso? Do we have any WhatsApp messages?
Thank you, Ishmael. We have a question from Wonga Sirai from Inkonjani FM. And the question is, before the lockdown was announced, institutions like Fort Hare University had fatalities due to questioned safety measures. Has the ministry looked at the issue since a couple of students were killed on campus? The second question says, some Wits University students have experienced challenges with online learning. Has the ministry discovered what is the challenge and provide possible solutions? Has the ministry looked on the issue of academic graduations since they were postponed and some cancelled? The question is being asked simply because it's everyone's dream to graduate when they enroll with the institution of higher learning. And then I'm moving to Precious Lisupi from the African Post. The first question is there a plan in place to pardon or assist the 33% of students that have to go back that suffer underlying respiratory conditions or diseases that could be susceptible to the fatalities of the virus? The second question, will university departments be allowed to query the type of courses allowed to go back from June 1st? For instance, lecturers of students majoring in subjects such as foreign languages may argue that while they don't need laboratories, they do need to have oral assessments and more contact learning than most. I'll leave it there for now.
Thank you very much, Tsego. Should we start, Minister, with the TM? You can come this side, TM, for any responses.
Okay, all right.
Thank you. Thank you, Minister, DG, and also Ishmael. I think I'll just respond to just one or two questions. Maybe the first one being with regards to the challenges as it relates to online learning. We've had extensive discussions in the task team around the mode of learning that need to be taking place in this particular period of time. And there's been an emphasis on this whole notion or concept of online learning as if that's the only mode which is available for learning in this period. And we've always emphasized the fact that there are going to be challenges if institutions want to pursue online learning as a mode. Firstly, students have registered in a contact university, and the pedagogy is completely different from, a student who's studying at UNISA or, distance and online learning. And secondly, the assessment is also going to be completely different. And that's why we, through the minister, have been emphasizing a multi-mode of learning, meaning that where possible, and where no student will be left behind, online delivery is encouraged, but also that we need to ensure that we deliver learning materials to students. We also need to ensure that student gets different forms of support for them to be able to to succeed. And yes, there have been challenges that have been reported, as would be the case with any system. But what I think is important is to emphasize the fact that when we say that there will be no student who will be left behind, what we essentially mean is that there will be these interventions in the temporary as we're in level 4. And if we remain in this level or into level 3 and there are still students who cannot go back to campus, there will definitely be a reconstitution of the academic calendar so that all students are able to be sufficiently prepared at the point when they're supposed to sit for their assessment. So this will include catch-up programs and all of that, so that all the students are covered. So I hope that that helped. All universities are implementing these different modes in whatever way that they deem fitting. But our emphasis is that no student should be left behind. And we believe with some of the measures that the minister announced today, those will go a long way in helping to empower some of the students who may feel that they've been left behind. With regards to graduations, graduations remains the decision of each of the universities. We cannot dictate to them what they should do. I know that there are thousands of students who are expecting to, walk that walk, but unfortunately, because we are under these circumstances, there is not much that can be done. Hopefully, universities will decide what they do with regards to graduation as part of being, their academic calendar. It's quite unfortunate that we're finding ourselves in this period. I've seen a lot of students being creative, Minister, holding graduation parties online, on Twitter, on Facebook, and all of that, dressing up, making up, and so forth. So unfortunately, that's what we'll have to live with for now. But hopefully, when conditions return to normality, universities will decide as to what happens with with graduations. And then maybe the last one being the type of courses. I think the explanation is quite clear from the minister's statement that universities will have to make a determination in terms of which courses are a priority when with the different levels. So when you say it's 33%, what are those courses which are so essential that students will have to be on campus? I think those categories are indicated. And what we also also emphasized as part of our discussions in the task team is that all of this will have to be engaged with the academic staff, students, and everybody else, particularly at a leadership level. We are not going to be prescriptive to the granular in terms of what courses should universities decide, to introduce as part of the different phasing in of students. So universities will have to take that final decision. Thank you.
Thanks. DM has covered most of the questions. Perhaps it's just two issues that it's one issue. Well, some have been sending me a message. Hey, Nzimande, ini kupa head. Ngiyaxolisa ngisebenzisa ulimi lwangakithi kwadamo. Kupa head balaclava. We don't want the balaclavas to replace the masks. We want the masks so that we can at least be able to identify you. Mawufaka balaclava ngizoxabana ngabi nominister ucela. Wonka, I think, raised a broader question about the issue of fatalities and things that happened at Fort Hare. We're very concerned about safety in our universities. In fact, we've just been disrupted by COVID-19 because we were planning as the Ministry and the Department of Higher Education and Training to convene a summit on health as well as on safety issues in our campuses. We really hope that post-lockdown and post-COVID, our institutions will working together with us and law enforcement authorities to ensure that we actually eliminate these unfortunate incidents. There's nothing as sad as a parent who sends his or her child to a college or university. Instead of that child coming back with an academic gown and a certificate, comes back in a coffin. It's a matter it's of very serious concern to us. In fact, we've just been thinking that perhaps we may need a very intensive investigation into the causes of instability in our institution and even reflect over the last 2-3 decades and try to really dig deeper into what could be the basis for such violence and such instability. Of course, our universities and colleges are part of broader society, but nevertheless, it's something that we need to work on very seriously together, and hoping that we are not going to be having such a situation. We say sorry to the students, as the TM was saying, who wanted to graduate. Some are creative. I know there's nothing. Myself, my first graduation ceremony is still stuck in my head, yet it was way back in 1980. Uzwa no mama bililizela kumnandi ugqoka ijazi lakho uyilizela. Maybe you'll find another opportunity and in another way to actually celebrate that. But it's a very important occasion. Siyabonga.
Ikense ngofu Minister. Ayeni mahlweni la Tshigo. Sikona sibutisho lexin'wana.
We've got a caller calling from UDAS Radio, and this is Mandla. Mandla, go for it with your question.
Okay, cool. Hello, Minister. I would love to ask the Minister these following questions. Will the NSFAS N+2 and N+1 be waived for the academic year 2020, as it is inevitable that many students will fail due to many factors, and that is a reality we cannot ignore? Second question is, many institutions of higher learning, like UWC, for instance, have not yet concluded their NSFAS appeals, meaning that some students have not yet gotten their allowances. Will they qualify for data and devices? And also, as other universities have loaned students devices before the DHET announcement, will the DHET then cover those costs of those students, including those that are NSFAS funded? And the last one, what will happen to students without funding, including post-grad students who are without funding, have no means of procuring data and devices? Are they not important, as the Minister only talked about NSFAS students? And yeah, thank you very much.
Thank
Right.
you.
That's all the questions that we have from the telephone line. Stand by for the WhatsApp line.
Tseho?
We have a question from Nazir from Glow TV. I understand that the implementation dates concerning your proposal of level 2 and level 1 are subject to the president's announcement. But from your department side, when you drew up these timetables of return to normality, around when did you envisage level 1 and 2 would be implemented in order to give a smooth effect to your plans for level 2 and level 1? The second one is from More Matsiriso from PSM. Can the minister tell us if there is a number that students can call if they have complaints about institutions that do not implement directions that you have provided or are not assisting students with the information material they may have or need to carry learning remotely? And the last question is from Mahlaku Komani from SABC News. What is going to happen to the monies that were paid by NSFAS to institutions for meals and accommodation? Will these be carried over to the next academic year, or will this money be forfeited?
Thank you. Thank you very much. Nna ke tla le thusa ka tabela ya dinomoro tsa mo le ka founelang gona. Re tla kgopela Deputy Minister tle ka pele.
Thank you. Okay. All content seems to be higher than normal. Thank you. Maybe starting with the last question around the NSFAS money. There has been a lot of concerns raised by a lot of students. And I think the thinking is that we've lost the academic year, but essentially we haven't. And all the efforts that we are involved into are essentially to save the academic year. So what it essentially means is that that money would be then used into as part of the academic year, as though it would have been, a normal academic period. So, and that's why there are all these elaborate plans, to ensure that students do go back and that we properly reconstitute the academic year. So the money is not lost. NSFAS funds students on the basis of an academic year or an academic period, and if those funds have already been paid, it means that universities and colleges will have to dispense of the service that has been, that has been paid for. So there's no issue there. Now, with regards to the, ideally, we would want to help all the students who need data, who needs devices, and all of that. And this intervention is based on the fact that a particular category of students have been defined as needy based on government policy. Of course, there are those students who may be qualifying, to get a government bursary, grant, and all of that, but who are not getting that grant and may not be falling within, that category as defined, which is NSFAS and Funda Lushaka students. But unfortunately, we have to focus on those students whom budget is permitting for us to be able to provide them with data and also with devices. But I think over and above that, what the minister also indicated in the statement is that universities are already making interventions. In fact, since our last briefing in April, we found out that there are actually a lot more students who have been covered in terms of devices and all of that by universities already, and that universities are already also doing that, and therefore we'll basically be looking at the difference. So the problem is not, the magnitude of the problem is not as big as we have imagined, and our intention is not to leave out anyone, but our intention is to ensure that we serve the most destitute. And in terms of government policy, we've defined the most destitute as being the NSFAS students. Thank you.
Thank you. The one question I forgot, if I messed this one up, higher health, Ramnik, you will help me. I think there was a question about comorbidities. Maybe I shouldn't chance that one. You as a medical practitioner, you will be able, maybe when I finish, to answer that one. And I think that maybe all what I need to say is that higher health is playing a very important role. But also what we must remember, it's not substituting the Department of Health. It's assisting in institutions in the immediate sense, which is very important work, something we never had before we had higher health. But also they are linking and working together with the Department of Health. But you can provide the specificities then on the issue of comorbidities. I don't know if I had correctly the first question on N plus something. I know that this is a big issue. In fact, last night, lots of students on Facebook were saying on me, address this matter. Now, we've made this clear. What is government policy for NSFAS students or for beneficiaries of NSFAS? In the past, when we were not paying for the full cost of study and other incidentals, including, by the way, no, accommodation is not an incidental. Food is not an incidental. But we're not paying for all those things prior to 2018. We had then said, for poor students, understanding where they come from will allow them a chance to fail twice. That's what we called N plus 2. N stands for the number of years for your degree. If it's a 3-year degree, it's 3 years plus 2. If it's a 4-year degree, it's 4 years plus 2. But when we then introduced, at that time, by the way, also it was a loan. It was not a bursary. When we then introduced a full bursary, which means you are not going to pay back, that's what happened from 2018. And we are paying for much more. For most students, we are paying for tuition, we're paying for accommodation, we're paying for food, we're paying for allowances, for learning allowances, and even personal care. We then said, by the way, judging from what many other countries are doing, very few, by the way, have got a system like ours at this level. In fact, I don't think there's any country at our level of development that has got what we have in terms of assistance to poor students. We then said... And
support too, Minister.
And support, yes. You are right, DG. So we can only allow you to fail once. Then, if you fail more than once, then we stop supporting you. In other words, we move from N plus 2 to N plus 1. Even that N plus 1 is generous. Now, I cannot understand why would students argue and campaign in order to fail. It just doesn't make sense at all. If there are specific instances or circumstances, maybe you lost a parent or a sibling, you couldn't write exams properly, institutions have got their own arrangements for that. In our days, they used what is called agrotat or other kinds of supplementary exams if you have failed but not that badly, and so on. This thing that you can actually go on a campaign to say, I want to be given a right to fail twice, when there are so many other poor students, firstly, who do well, but they are very poor, but they pass well, they work hard.
Engaged.
And also there are those who are outside the system who want to get out of the system, but they are not. I've said, though, to the student leadership, because we are a listening government, come and convince me why you think you're right. Also give me a chance to convince you why I think you're wrong. Also, and ibalekile lento ukuthi sisho ukuze nabazali bayilalele. Umntwana simnika ithuba lokuthi ungafeyila kanye ngoba siyazi uma uqhamuka endaweni okuhlushekwayo kuyona, mhlambe nokuthi ukujwayele nje enyuvesi kuse umsebenzi noma ekolishi. Kodwa ukuthi ufuna ukuthi sikuyeke uzufeyile kabili. Kube kukhona izingane ezinye ezikwazi ukuphasa nazo zibe zihlupheka njengayo lengane. Kube kukhona bami ngaphandle abafuna ukungena ngaphakathi. Bese kuzoba khona umkhankaso nje omkhulu ukuthi hayi uNzimande yasingena indaba yakhe ngoba akasivumeli ukuthi sifeyile kaningi. Kanjani ngizoyenza kanjani leyo nto? That's actually not correct. But I've said kulungile siengage siconvinceane. As government also we must remember. It's less than 10%, DG, if I'm not mistaken, of students who start grade 1 who go to university. What's the exact percentage? 12%. Out of 100 students who start to grade 1, only 88 are at university. And many of them are sitting at home unemployed. Now, Ulmen, kamongameli uRamaphosa ukhipha 350 rand. Ukuyokondla abantu bakithi abanye abangakaze balibone isango lasemsebenzini abangenalutho abalambile. Wena uyasupportwa ngayo yonke into kodwa uthi ngicela ukufeyila kabili. Kukhona izingane ezingawuphasile umatric ezihlele emakhaya sifuna ukubeka imali sibanika amakhono. Kufanele imali ithathwe iyonikwa wena ngoba ufuna ukufeyila kuze kube kabili. Nangaphezulu. Bathi abawufuni kwalo N+2 abanye. It can't be. Asihlaleni phansi sixoxe. Nabazali ke bayizwe kahle lento. Sikhokhe imali ezinzima. Into sithi abantwana bazoyikhokha le mali. Isikweletu kuphela nje sisodwa abanaso ukuthini uma sibanika le mali abafunde baphasa. Now, ngiyazi ukuthi baye bangathanda uma ngikhuluma kanje, but I have a responsibility and a duty ukuthi ngikhulume kanje because I know very well how much government has gone all out to actually try and assist students from poor families. Njengoba ngisho nje alikho izwe elilingana nathi ngokuthuthuka nangozomnotho elenza lento esiyenzayo. Now, we are aware of the issue of the missing middle, as I have said. Those who do not qualify for NSFAS, but their families are not rich either or wealthy. That is why what we have committed as government is we are exploring the possibility of an affordable loan scheme system. But that won't be funded by government. It will have to be funded by the private sector. We will have to work with the private sector in order to be able to assist and be able to get some form of a loan or the other. Some universities have said to students who do not qualify for NSFAS, we'll give you a loan to get a laptop. You will pay it after we have finished or something like that. We are encouraging that. Not that we are encouraging indebtedness, but we are encouraging institutions who can afford to do that. And also as government, we have called upon last time, that's what I did, to the Good Samaritans. And I think also we'll be launching a proper campaign to say those who have got some change, can you please buy any student who may need a laptop who does not have it for purposes of learning. That's the kind of social solidarity that we need. Ukuthi kulabo abadla izambane likaPondo sicela ushintshe nje kuphela ngoba ilaptop ukubona ushintshe ukuthi bakwazi ukuthi bathengele abantwana imfundo akusiza ngendlela okufanele ukuthi zenze ngayo. Once we reach each level, there are also, by the way, corresponding rearrangements of transport. I think that when we get to level, I'm not so sure about level 3, but where we've got to transport students interprovincially under level 3, there will be the necessary arrangements that government will also put in place. Together, working together, of course, with the Minister of Transport and other relevant ministers to ensure that students are able to get back to their institutions. We'll be able to do our best insofar as that is concerned. We're going to be giving the numbers at the end of where people can phone for what problems, including those. I like this question of saying, where do we report those who do not follow what we have said must be done, whether it's in terms of health or whatever? We will be giving all those numbers. Ishmael, please do not forget. Engathi ungayinika basekhona nalaba beindaba. Ngoba siyasebenza nabo kufanele ukuthi le indaba bakwazi ukuthi bayihambise yonke indawo, ikakhulukazi lo msakazo wakithi u-SABC, ukuthi usisize nawo sibambisane ekwenzeni lo msebenzi. I think okunye uDeputy Minister usekushilo. Cabanga ukuthi ngathi siphendule konke. Ramnik, awuze uzochaza lento ye-comorbidity, uyichaze nangesingisi esilula nsizwa kithi.
Thank you, Minister. Absolutely. I think the comorbidity question is a very serious question. As more global data is coming across the world and science is evolving, we're trying to understand the impact of this virus with many other underlying conditions. The first thing that comes to our mind when it comes to comorbid conditions is elderly staff members, specifically staff who will be above 60 years of age. And then the other comorbid conditions are any condition that obviously reduces your immunity, which obviously has shown through global data that once your immunity levels are down, the virus has a more severe infectivity to your body, and your body reacts in a more severe form. As much as we, all of us, are equally susceptible to this virus, as we all have no immunity, and that's how the virus has been quite predominantly a very serious challenge to the country and to the globe. Now, the DPSA guidelines, the OHS, the Occupational Health, as well as the Department of Labor, had made it very clear from the beginning about elderly who are above 60, or student and staff with very severe comorbid conditions where the immunity is absolutely compromised. The priority for them is to stay at home. And for institutions of higher learning, for those staff, the aim is to try to rearrange their jobs so that most of it can be done from home. But for any reason, it cannot be possible. Then the biggest signs that we have to understand how this virus spreads is the nose, eyes, and mouth. And how do we provide extra protective PPE for specifically those individuals who have comorbid conditions, so that if in case for any reason they can't stay at home and it's necessary as the levels of lockdown goes down. And remember, when the levels go down, then the practical reality is that the community spread of the infection is also coming to that magnitude of it. So the aim will be is the extra PPE, which is obviously as per the guidelines. And I think we refer back to the DPSA guidelines, the Department of Labor guidelines for everyone who's on comorbid conditions. And for those students and staff, it is very critical that even when you do the health check that I launched this afternoon about the health screening app, there's a particular question as the NDOH screening tool goes through around the comorbid conditions. And it gives you your result based on your comorbidity around what step you must do eventually, whether you should go to the campus or not go to the campus. Thank you, Minister.
Yeah, Ramnik. Colleagues, do we still have questions? This will be the final round of questions we are taking as we prepare to wrap up our media briefing. Then I will share with you towards the end of the briefing these most important numbers that the public can use to access our department, including our agencies. Tshego, do we have any messages from your side?
I'd like to believe you've got one caller on hold, and this is Mtunzi from Kakasi FM. Mtunzi, go for it with your question.
I would like to ask the minister and the deputy minister what is going to happen with because we've been getting a lot of phone calls about a story in and around Durban. What is going to happen with those landlords that are carrying more than 15,000 students for DUT, UKZN, and MUT that haven't been paid, but students are expected to return to these residences and they left their belongings in these residences? What help can the minister offer, or negotiations with the university in accordance to that situation in Durban? Because most of the residences have been broken into because the landlords cannot afford security anymore. And the universities have come out to say that they cannot pay the landlords and because they can't afford it. One university has come out to say that they're not going to pay the landlords, therefore they're cancelling the contract. Now we're talking about 15,000 plus students here. When they eventually return, where are they going to return to? And that is the concern.
Thank you very much, Mtunzi. Do we still have any other question? This is the last one?
We have an outstanding question from the WhatsApp, and Tshego will just forward that to you.
Okay. Which one? We did receive the question. The DG has been looking on it now, and we will give a response as well. Or probably I should just read the question. It's from Nazir from Glow TV. He says he understands that the implementation dates concerning our proposal for level 2 and level 1 are subject to the president's pronouncement. But from our department side, when we drew up these timetables of returning to normality, around when did we envisage level 2 and level 1 would be implemented in order to give a smooth effect to our plans for level 2 and level 1. Thank you, Minister.
The DM is going to answer the one on landlords and accommodation, yourself and then whoever else may want to add. It's nice to have a young DM because you leave all the difficult questions with him, you see, as a minister, so you can have the easier questions. The one of moving to level 2 or level 1, it's very difficult to say. That is why we don't have dates. We all are hoping that we are able to coexist and be able to conquer this virus such that we are able to save the academic year. And save lives, of course, as the most important thing. Now, on this, the president has said it. We will firmly be guided by science. And what is likely to happen, the threats that are there, and our capacity to deal with those. So it's very difficult to say. All what we want to say as our message is that keep on keeping safe and also listening to us. We will be making periodic announcements and engagements. The president, of course, will be leading that. But insofar as our sector is concerned, we will also be making periodic announcements. We can really only hope that we are able to defeat this virus, although the reality is that we are still going to have to coexist with it, possibly right into next year. Because until we get a vaccine, and usually you don't get a vaccine under 12 months. Usually vaccines is 12 to 18 months because you have to test it. Ayi-vaccinate. Kufanele uyiqale emagundaneni kuqala. Bona ukuthi lenze njani igundane before uyoyisebenzisa kumuntu. kuthi uyakwazi nokuphila uhlaba igundane nje ngale injection ubone uyasebenza noma liyafuma lisafu ubone ukuthi hayi kusho ukuthi akalunga ke kuphindelwe elaboratory kuyolungiswa nayo yonke lento. Sithembeke ukuthi mhlambe ivaccine mayengakafiki mhlambe kuzoba khona imithi okungenani ezokwazi ukusibamba lesifo ukuthi abantu abasitholile bakwazi ukuthi baphile basinde. Bayasinda abanye njengamanje kodwa abanye abasindi ngesho. Izinto zonke sizenzayo. I must also say, by the way, that on our side as the Department of Science and Innovation, we're heavily involved. We are part of the tests that are being done by the World Health Organization on medicines and other things. And also, by the way, we are doing what we call repurposing of drugs. I think I explained this last time, to see whether certain drugs, say drugs against malaria or TB, how are they responding to this pain, trying to treat this particular disease with certain medicines. There are trials that we are part of. The other thing that we are part of, we are building our capacity now as South Africa, that in case then or when a vaccine is found, we are also able to produce it here, to manufacture and produce it here in South Africa, because we do have that capacity. We are now just looking at increasing it so that when that time comes, we are able to produce even for the rest of the African continent, for that matter, given some of the capacity that we have. We can only really hope for the best, but we mustn't only hope for the best. If we are coexisting with such a virus, let's follow the rules, let's follow the suggestions, let's cooperate. That is why even myself, I wish we wouldn't talk about social distancing, but we would talk about physical distancing with social solidarity. Because we do need that. If you are behaving, that's part of social solidarity, because you are protecting yourself and also protecting someone who is actually next to you. But we'll be keeping everybody informed, and Ishmael also is going to leave the numbers so that anyone who wants to ask anything, we are actually more than prepared to be able to answer that. DM ngawuzophendula lembuzwanyana ke elikhulu elungele nina neyintsha ukuthi ngixoxa ontanga bakho labo kusempeleni esikhuluma ngabo awubatsheleke ukuthi uthini.
Thank you, Minister. The issue around landlords, we I mean, through the department, have had some meeting with the associations that represents private residence providers, because the concern obviously has come through, and students were abruptly requested to vacate residences, go back home when the initial lockdown and early recess was announced. So that's just but the one part. And then there are also parents who are concerned and students who are concerned that they have paid for accommodation and meals and all of that in advance to institutions. And if they're not returning to campuses, what is going to happen to them? So that's also the other part of the of the concerns that we have received, and as is the case, we have requested that a report be submitted to the task team on the basis of the discussions that is taking place with the private residence associations, and also what considerations would universities be making in terms of accommodation, meals, and all of that. But the point which we want to emphasize, which I made earlier on, is that our intention is to oversee the completion of the academic calendar. So which means that if you've paid for accommodation for the whole academic calendar, there will not be an expectation on the part of the parents to pay for more money when they return, when the students return back to campus and all of that. But what we also want to encourage, and which is what has been happening, as part of the response by institutions has been to engage directly with the private accommodation providers. So a report will then be brought to the task team, and then we will make some recommendations on the basis of the report that we will receive. But also, I think it's important that we emphasize, the fact that these are not conditions that we've chosen to exist under. It's conditions that are imposed on us, and therefore whatever engagements that take place either between universities and the landlords, or between the students themselves and the landlords, and even the engagements that we're having with the associations of private accommodation providers, should take that into consideration. We understand that this is about an income that has been guaranteed over a period of time, and we really empathize with that. And obviously, all of those issues will be taken into consideration in whatever deliberations that we have in the ministerial task team. Okay, I hope that that responds to to the question. Thank you.
Can I just clarify one last thing? I am a modern minister, DG, who is on Facebook, Instagram, and Twitter, although I don't tweet. I just want to clarify something, because there's something that is being misread when I spoke about manga leadership. I wasn't referring to student leadership when I said manga leadership. I was referring to all those leaders who mislead people about how to deal with the virus, either in a populist fashion or in an opportunistic fashion. If I wasn't in a government platform, I would also even name some of them who are causing us lots of problems. So I wasn't referring to student leadership. There are opportunists and people who are not able to deal with this through misinformation or fear to engage their own constituency to understand what we are dealing with. Instead, many of those blame the president, whatever the president does. Manga leader would be the one who would say, President has declared a lockdown, he's against us, he's killing the economy. But once he lifts the lockdown, the very same people will actually say the president wants to kill people. Those are manga leaders, because they are not principled. So this mustn't be misunderstood as if I was criticizing student leadership. I don't spend that time with student leadership. I spend time engaging them. Robustly sometimes, yes. Thank you.
Re Minister. Re fitlhile mafelelong a lenaneo la rena la lehono. I will now take this opportunity to give the information that you requested for. Firstly, let me start with the Department of Higher Education call center. The numbers are 0800 87 2222. 0800 87 2222. NSFAS numbers. 0800 67 327. 0800 67 327. You can as well send an email to NSFAS at info@nsfas.org.za. For SETA's enquiries, please call the landline 312-8. Let me repeat, 012-312-5896. Or send an email to ngubane.m@dhet.gov.za. ngubane.m@dhet.gov.za. For members of the media, You know my number. We always communicate on that. So all the queries which are media related, please do send it to my cell phone number and my email address that you are well conversant of. This, ladies and gentlemen, brings us to the end of our media briefing. I would like to thank the Minister, the Deputy Minister, the DG, colleagues, CEOs, DDGs, who are present here, and all of you members of the media, ladies and gentlemen. Thank you very much. I now hand over back to the studio in Auckland Park. Thank you.
Thank you indeed. That was the press briefing by the Minister of Higher Education, Science and Innovation, Dr. Blade Nzimande. Basically briefed, media briefing, basically updating on the status of where they are and the preparations, looking ahead to the possible level 3 lockdown. Welcome back to the SABC News Studios out at Nasrec. I'm Tabi Sositole.